Tes satu tes cek satu cek satu cek satu cek satu cek satu dua tiga serta lecturer yang baru datang mungkin bisa isi depan sini dulu ya. Mari maju isi depan dulu. Nanti biar apa profnya nggak kesini soalnya kan profnya mau direkam ya. Kalau sini kalau misalnya hari ini kosong nanti profnya bakal kesini. Jadi isi sini dulu ya biar target apa keterbukaan dari acara ini bisa kelihatan. Jadi profnya bisa berdiri di sini. Jadi oh ya. Mari. Ini kalau beberapa yang di belakang, yuk kok isi sebelah dulu. Biar profnya enak pokoknya. Ya, jangan disuruh maju dulu. Ya, yang sebelah sini dikosongin dulu kali, dikasih dulu kali. Ya. Jadi kalau bapak datang ya, nggak ada bapak sakit kan? Kalau ini kan kalau di itu ya, kalau live streamingnya kalau ini ya. Jadi takutnya nanti profesornya kalau ada orang di situ dia berdiri di sini, kan nggak bisa direkam. Kita sebelah sini kali ya, mau dulu di sebelah sini. Ya mari. Jadi ke bapak ibu. Nah kalau udah izin baru dia pindah. Yuk bantu saya yuk.
Lebih dari soda.
How is everyone today?
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. How are you today? Okay. I'm happy to see that you're fine. Okay. Now we already have our distinguished speaker, Professor Alicia Pinky Matthews, welcome to the section. And also we already have Dr. Henry Pujasani as the head of International Office and Administrative Faculty Nursing, welcome, Dr. Henry. And also we already have Nurse Utami. She will be our moderator for this lovely lecture. Welcome, Ms. Utami. And now before we are in the presentation from our speaker, let me deliver the introduction for all of you first. We are now at classroom 505, 546, fifth floor, Faculty of Nursing, University Indonesia. There are three emergency exits, three doors in the left side of this room. You already know that there are three doors, right? The left side. And there are two potential emergency conditions which may occur, which is fire and earthquake. In case of fire, please be calm, do not panic. Inform our occupational safety help team for fire location. Evacuate immediately by following our officer to the assembly point. In case of earthquake, please be calm, do not panic, and do not overcrowd. Drop, cover, and hold those. Choose a safe location, avoid window glass and hanging objects, and protect your head. When the earthquake has hit, evacuate to emergency stairs and follow our officer to the assembly point. Another information, please be careful when you step on stairs and always use rails. Based on Universitas Indonesia Rector's degree, our university is no smoking campus. Please protect the university's environment and let varieties teach the right discipline. Thank you. Okay, now we will hear a short speech by the Dean of Faculty of Nursing, represented by Head of Administrative Office, Dr. Henry Pujasani. Good evening, stage is yours.
Assalamualaikum warahmatullahi wabarakatuh. So we are here. We have Professor Alicia Kempin from University of Illinois Chicago College of Nursing. So we'll be here for about 2 hours. And actually, even for those who can yesterday to the public lecture, we already know who it should be. But today we're going to focus more on what's the topic of global health leadership. So yesterday was something else, and today we're focusing on global health leadership. And Professor, with you we have who are the here. Dari apa aja? Masing-masing or specialist. So we have here, we have a Master of Nursing focusing on community health. And then, what else? Doctoral student, first, second year, third year, first year. And then what else? That's all? That's all. Okay. Yes. So on behalf of the team, we really happy to have you here, to have Professor Alicia here, and we will learn a lot from her. Hopefully, ask questions as much as possible. Please feel free, don't be hesitant. And yeah, I mean, this morning I was so impressed by her comment about us. Like yesterday, she was surprised that the lecture here is more and more, what's that? Active, like student is more active asking questions compared to Japan. So it's amazing, right? Applause for us. So I'm hoping that today's lecture will be the same. Ask more questions, be active, so share your idea, and have more or knowledge from her. Okay? And I think that's all for me. Enjoy until the rest of the session. So I go for
Thank you, Ibu Ning, for the speech. Okay, now may I ask for the participant to sit back to move to the front because it will be easier for the speaker to interact with the participant. This is still active. Pasal pasal apa lagi mau datang? Kita datang. Kita lebih enak nanti interaksi dengan ada di mana lagi pasal sedikit. Ayo, jangan saling hina. Apalagi yang Bapak Ibu dari nanti yang di profesor. Okay. Yeah. For the presentation, we have 2 hours, and the session will be moderated by Nurse Utami. So I give the exponent to Nurse Utami to welcome the professor.
Thank you so much, Mr. Firman. First of all, I would like to introduce myself for whoever who didn't know me yet. My name is Utami Rahmawati. I'm the junior lecturer here from the faculty of, from the community nursing department. And here today, I will be your moderator. So maybe, as Mrs. Henning said earlier, I would like you to pay full attention to the lecture because I think this will be so much fun with the new global health issue. And I hope also you will get a lot of information for this today session. So at the end of the session, I would like you to ask also a lot of questions, maybe regarding research or something else. So without further ado, please welcome, please give a round of applause to Professor Matthew.
Thank you. Good morning, it's so nice to see all of you again. How many of you were at the lecture last night? Oh, okay, so only about half of the room. So let me do a little bit of introduction. My name is Alicia Matthews. I'm a clinical psychologist at the University of Illinois at Chicago. My nickname, my family name is Phoenix, like the bird rising, the mythical bird, Phoenix. So you may call me Phoenix or Dr. Alicia, up to you. So I have been working at the University of Illinois at Chicago since 2003. We there at the university are very much focused on improving the health of communities, especially communities that are underserved and who have high need because maybe of poverty or lack of experiences. So that is the mission of the university, and it's the same as the mission of the College of Nursing as well. I have, as a psychologist, my area of research is on health promotion in the areas of cancer prevention and control. So my work has focused on cancer survivorship. I have done work on cancer screening, and more recently, I have been focusing on community-based smoking cessation treatment programs. So looking at development of culturally targeted smoking cessation interventions at the level of the community. So the other areas of expertise that I have is I have done lots of teaching internationally on scientific writing for publication, as well as research methodology. So those are the things that I spend my day teaching and thinking about, and hopefully I will be able to bring some of this information to you and to talk with you about questions that you might have as it relates to your research, especially the doctoral students who must be planning their dissertations, right? So in the United States, in the classroom, we have a lot of emphasis on participation. So we like to share, and I like to learn as much from you as you will learn from me. And so feel free to share your experiences, to ask questions, to talk to me about the lecture. So this class is on global health leadership. Yes? Yeah. So one of the areas of global health leadership that I have learned from your team this morning is that there is a lot of emphasis on research, both being national and international leaders in global health research. So the focus of my lecture today will be on some of the skills and requirements to show leadership in global and international research. That is great. Before we start, can I learn a little bit about your areas of research interest? So I know my doctoral students here, my master's students here, right? So what are some of the areas of your research interest? School-based nursing, yeah, yes, others?
I'm interested in smoking cessation.
Ah, yes, hey. All right. Other folks, pediatrics? Any interest in pediatrics? Pediatrics and community. Gerontology? Older adults? No? How about non-communicable disease? No? Yes, yeah, okay, yeah. Other areas, what are your topics? Yeah? Your topic?
My topic about empowerment.
Empowerment. As it relates.
Structural empowerment.
Okay, all right, wonderful. And are any of you interested in international or global research? No, not yet. Oh, hopefully you will. Hopefully you will. Okay. So, cross-cultural global health research. What do I mean when I say cross-cultural? Cross-cultural. Yeah. Looking at differences, working about conducting research in a context that is not your own cultural background. And there is a lot that we have to learn about nursing and psychology in communities that may be different from our backgrounds. In the United States, especially in Chicago, we are a cross-cultural society, multicultural society. And so one of the basic foundations in nursing is the ability to work in Latino populations, to work in Asian populations, African American populations, Caucasian populations. Even though that may not be our background,
we develop the cross-cultural capacity and training to work effectively as a nurse, as a researcher, as a community person across different population groups. And so that's one of the things that we have as a value as our nursing program. But it's also going to be something that I will be talking to you about in terms of conducting research. Even if you may not be interested in conducting research internationally, you may be interested in working with populations that are different from your own. So for example, you may be interested in working with different ethnic or religious backgrounds. You may be interested in working with immigrant populations. Or populations like HIV positive that are, again, you may not share the history and the background, but you have to learn to work across these differences. So, these are the things that we will be talking about. In terms of the international global research, in terms of the leadership, identifying what are some of the key priority areas? What are the areas that are most important right now? What are the ways in which we can increase our cultural competency? How do we establish research partnerships, either internationally or in the community? Information about funding, conducting research, and then disseminating your research, such as publications. It would probably help you if I stood still, wouldn't it? All right, I'm gonna try to. All right. Global health research. Let's start with the definition. So it means research directed towards addressing health concerns that contribute a significant burden of disease in both low and middle income countries, and that are also a concern to the global health communities. So give me a couple of areas that are right now priority for Indonesia in terms of research. Just tell me those. What are some research or health priorities for Indonesia right now that are causing significant concern? Mother and child health, okay. What other areas? Okay. Okay, all right. So as I travel and do lectures sort of internationally, non-communicable diseases is an important priority globally as defined by the World Health Organization. In the past, it has been much more focused on communicable diseases, tuberculosis, HIV, hepatitis, those types of things. But now the health problems that are related to the most disease and disability are related to non-communicable diseases, particularly lifestyle issues such as obesity. Also, a lot of attention related to maternal and child mortality. So when we think about our national and our international priorities, we think about how do we maximize our success in those areas. And so here are some of the priorities in which we think about. Develop programs that are effective regardless of the context, in Indonesian context, African context, other Asian contexts, to be able to develop interventions that are effective but are low cost. So we have many interventions that require a lot of funding, a lot of technology, but if we are wanting to improve the health of low and middle income countries, we have to be able to develop strategies that do not rely a lot on technologies and that do not require a lot of resources. The other things that we think about are improving access to care, both physical health care and mental health care, having high quality care, and then developing programs that are sustainable. But one of the mistakes that we can make quite a lot is that we will develop a program that we come, we bring the resources, and then when we leave, the cultural context is not there for us to continue to work without our support. So sustainability is another area of importance, especially as we think about community work, right? Sustainability. Can the work continue even if you, as the leader, leave the project? Can the community members help to continue that work on their own? Is it sustainable? So, for the U.S., in terms of the global health priorities, we have the Globally International Center for the National Institutes of Health. And it has established some of the following priorities for funding. First is to provide effective and low-cost interventions to address the health priorities of the WHO, mostly related to non-communicable disease. The second priority is to look at and monitor the progress of our interventions. So we want to know that if we are bringing an intervention to the international or to the community context, that is effective and that it is helping to improve the health of communities over time. So that is another priority, is that the interventions are low cost and effective, and that they are effective for improving the health over time. So that means that we have to develop effective strategies for evaluating the benefits of our work in our interventions. So we think about that in terms of your doctoral programs and your master program research as well. How do we monitor and evaluate the effectiveness of the research and work that we are doing? Okay, so first area was discussing the priority areas. The second is looking at cultural competency. A global health expert is one that has high levels of cultural competency. That means the ability to have the values and principles that are related to many different cultural contexts, to focus on sustainability, to have respect for cultures that are different from oneself, also to focus on health quality, equality, and social justice. In the United States now, these two areas are very important in terms of the research that we're doing and in terms of cultural competency. In the United States, there are lots of disparities in health and health outcomes based on race and ethnicity. In the United States, even though we are a multicultural society, there has been a history of discrimination and prejudice against communities of color, African Americans, Asians, and Latinos. As a result, those communities can have lower health and health outcomes. And we are focusing on social justice in order to improve the status of those communities, in order to improve the health outcomes. We have shown very clearly that discrimination, can I say that term for you? Discrimination? Yes, familiar? We have shown, a lot of research has shown that discrimination, stigma, and social exclusion can have a very negative health impact. That happens in 3 different pathways. Can you think of the pathways in which discrimination can have an effect on health? One pathway is, what are the mechanisms or pathways in which discrimination can have a negative effect on your health? Any ideas?
Apa yang bisa terjadi kalau mungkin di lingkungan kita terjadi diskriminasi? Kira-kira apa yang terjadi pertama kali?
Yes. The one pathway is through mental health. such as depression and anxiety. If you are an individual who experiences a lot of stigma and discrimination, the research has shown that it increases the level of depression, anxiety, and that can have an effect on both mental health and physical health. So one pathway is through mental health. The second pathway, is there a marker? So, yeah, okay. Second pathway. Physically, yes. So the second pathway is physical. So that pathway is two. One is that if we have a lot of depression and anxiety because of discrimination, we are more likely to engage in poor health behaviors such as smoking, drinking, taking drugs, overeating. We have shown that those health risk behaviors as a way of coping with the anxiety has shown to increase our weight, cause our health problems. So there's the physical pathway that is through poor health behaviors like drinking and smoking. The third pathway is that we have shown that discrimination and stigma can also have an impact on the stress hormones of the body, which reduces your ability to fight infection and can have a negative impact on your body's ability to remain healthy. So discrimination, social stigma can have a negative impact on health through three pathways: mental health, health risk behavior, and the ability of the body to fight infection, fight illness. So we are finding that it is not enough to give people medication and treat their illness. If we want to improve health equity, we must also fight for social justice. Yeah? Okay? That is our current belief in the United States. All right, so when we think of cultural competency, it is a willingness to, an ability to take into account and to understand and appreciate the diversity of the communities that you are working with, and to treat them as equal partners in that work. There are 5 components to learning and demonstrating cultural competency. Okay. The first is awareness of cultural beliefs, attitudes, and norms of that country or those communities. So before I come to Indonesia, I have to ask my colleague who has come here quite often, what are the cultural beliefs that are important for me to know so that I show respect? What are the things that I need to know so that I do not cause embarrassment or any difficult experiences? This is something that I need to know and to learn so that I come and I show respect for this new community that I'm working with. First step in cultural competency is to learn the cultural beliefs and norms. It does not mean that we have to adopt necessarily the cultural beliefs and norms. I'm raised as a Christian, and many of you are Muslim. That doesn't mean I have to convert to be Muslim, but it must mean that I must have to respect your religious beliefs. Okay. The second is having an attitude of equality. Non-colonialism. That means I don't come and say, I'm from the United States, I have all the right answers, you are not American, you do not know that, right? No. In the past, many of our researchers have done that, and we recognize that as a mistake, and we apologize for that in the past. Here, we are equal, I learn from you. We share ideas. My ideas are not better because I'm from the West. My ideas are just maybe different, right? So having an attitude of equality. I want to just make a note so you will remember the 3 pathways. Okay. So as we were talking before, the 3 pathways that discrimination can lead to negative health. Mental health pathway, behavioral health pathway, smoking, drinking, eating, and the physical health pathway, the ability of the body and the immune system to manage stress. Okay. Any questions about that before I continue? Any questions? All right. The other 3rd way that we demonstrate cultural competency is to have some knowledge of the institutions and systems of the communities, of the institutions and the countries that you're working with. The 4th way is having communication skills that are respectful, having an openness to collaboration, and then the 5th component is valuing diversity. Valuing diversity of cultures, opinions, and strategies. All right? Which of these, in your opinion, which of these 5 components of cultural competency is the most important for you, in your opinion? Yeah. For you.
Dari kelima kompetensi yang ada di sini, kira-kira yang paling penting kita punya itu yang mana? Semuanya penting.
All of them is important, but the first will be awareness.
Awareness. Okay, yes, why? Why is that? Why do you think that's most important?
I think we must mindset, our mindset, make our mindset ya, kita harus mengubah pola pikir kita tentang kesadaran berbeda, kira-kira akan perbedaan kultur, different culture. We must awareness about that.
Okay.
Thanks.
That's
Sorry.
okay. That's okay. All right, pass it around. Someone else. Which of these is most important to you and why?
Okay, thank you. I try to answer your question. Maybe the skill of communication and collaboration skills. I think in communication we can affect the type of the competence.
So in your opinion, communication is essential for the other components. Okay, yes. How about for you?
Thanks for the time. But I think five components of cultural competence that most for me that awareness of cultural belief, attitude, and norms. Because of when we are come to the one culture of the village, so maybe we have to have awareness for them about the belief, attitude, and norms. But these five components is that's all important. We can we can say that it's not everything important, but it's always most important thing.
Yes.
From the five component of cultural competency, I think the five of them is most important. Like, I think the awareness of cultural belief and attitude and norm is most important because, as you know, in Indonesia we have so many ethnics here, and we as adults we have to aware that we have a different culture with our pressure, maybe we have a different culture with another camp. So for me, is awareness of cultural belief is most important, and also the valuing of diversity because in Indonesia we have so many ethnics here, and in our hospital we can spread. I only give care to with the same ethnicity. Of course, it's not. Yes, because we have the same value for our patients. So maybe that's all.
Okay, thank you, thank you. It's very interesting to me to, yes, all of them are important, but it's very interesting to me to learn how you think about each of these ones and how you think about it in terms of importance and why. So, interesting. Which of these do you think is the most difficult to achieve? Which is the most difficult to achieve? Attitudes, knowledge, yeah. How about, I think really the most difficult is an attitude of equality. Because all of us, whether it's by intention or not, many of us will hold attitudes that some lower income people or some other cultural groups, if they would not do this, if they would not do that, it does not mean that we are a bad person. It's just that we have heard many messages about ethnic groups, about countries, that we have not questioned in the past. And sometimes that can shape our attitudes. And we are thinking a lot in the United States, we have to do a lot of work to undo these attitudes that we have about some groups in order not to be disrespectful, in order not to see them as less than. So for me, this attitude of equality is one of the most difficult to achieve. Yeah? Others agree or disagree? Yes, agree. All right. So let's look at them in more detail. So communication patterns. To be one culture comment, one number is communication patterns. How decisions are made, cultural norms and behaviors. So communication patterns. When I go to Japan, I have to be aware that the likelihood that someone will disagree with me in class is not very good. It's not very high. Culturally, it is just not something that they will do. So I have to teach in a way that is not necessarily disagreeing with me, but to add another voice. So I say that, right? I don't say, who agrees with me, who disagrees with me? No, they will not disagree with me. That is being shown as disrespectful. So I have learned to say, give me another voice. Tell me another voice, another opinion about this topic that we have not said so far. That encourages more communication and more discussion. So it's the language that I use, having to know the culture. They have a strong value about harmony, no conflict, not disagreeing. So the language that I use has to be adjusted for me to be effective in that environment. How are decisions made? Some cultures, the people with the highest education, or men, or the religious leader, those will be the people who make decisions. I have to know that, because if I go to the wrong person, then that is showing disrespect to the leader of that community, and that will cause a barrier. Other times, no. One person will not make the decision. It has to be a collective decision. In order for the project to move forward, people have to talk and talk and talk and talk. One person cannot be the decider. Many people have to come to consensus. And so you have to know, is that the culture that you're dealing with? And so in the United States, in the hospital, we have a tendency to say the patient must be a part of this decision-making process. The patient must give their opinion, only the patient. But some cultures, like from Latin American, they're collective. We come to the appointment, we expect one person to come. You come from Mexico, 10 people will come to the appointment. Sit down. They say, well, who's the patient? Us. Not this person. We as the family are the patient. We must all understand, we must all be in charge of taking care of that. And so we had a lot of problems with our nurses. No confidentiality, we cannot have so many people in the room. And then the family was asked to leave. The patient, they get up and leave. No, I cannot, this is not my culture. So again, having some awareness of these factors will help you to be more effective. Also, it's important to know what has been the historical relationship between countries. I know that as an American, some places, countries that I will go, I have to acknowledge that we have a history of colonialization, or we have a history of war and atrocities. And in order for us to build trust, I must acknowledge that history. So that's a part of cultural competency. Okay. Learn the basics of a local language. All right. I'm very good at language. I try. So the way that I acknowledge that is that I never insist that anyone speak to me in English. I say, if it's hard for you to express the idea in English, say it in your language, and then someone will translate. No need to apologize. I don't know your language. It is not your responsibility to know my language. It means we find some way to communicate, maybe through a third person. That shows cultural competency. But some Americans, they say, oh, I would not understand there to teach. They don't know enough English. You're going to that country. You have to learn the Indonesian language. Right? And then finally, it is important to have someone on your team that is bicultural, meaning that they, like Professor Henrichisa, that they have knowledge of Indonesia and they have knowledge of the United States, so that they can help the teams or help to communicate and bridge the understanding. So this is for me very important. I would never come to another country and to try to do research without having someone from the local context who was my partner in that research to help to bridge the understanding. Some frameworks that we think about in terms of cultural competency when it comes to research, some of which you may know about. One main one is community-based participatory research. Those of you who were at the lecture last night, we talked a little bit about this. The main premise, the main idea of what we call CBPR, you familiar? CBPR is that, yes, is that we are true partners in the work, and that many of the ideas must come from the community, and the researcher is there to work in partnership with them to solve the problems that the community wants to solve. That's very different from me saying, I'm looking around, Indonesia, you have this problem, this problem, this problem. Let me come and fix it for you. No, that is not very cultural competency. It is saying, what are the things that are a priority for you? Why is that a priority? How may I be helpful in helping you to solve that problem with you being a leader, right? That's an example of how I would show cultural competency in that way. All right. Any questions about cultural competency? Yes.
Yeah, ada framework for sector planning and technology factory research. What is the difference between research?
Good question, yes. Emancipatory research framework is a philosophy. It's a way of thinking about the goals of your research. Like CBPR, it's a way of thinking about, it's a philosophy, it's a way of thinking about the goals of your research. It is saying that CBPR is saying that the community goals are the priority. Community involvement is how we solve this problem. Emancipatory research means there are groups who have been discriminated against, who have not had social justice. Emancipatory research is aimed at reducing the discrimination and increasing the ability of those community members to have full equality. So it means building capacity. It means developing leadership. It means following their pathways in terms of understanding of how to move forward. So the goal is to elevate. Yes.
Same with feminism research maybe.
Yeah. Yeah. And like empowerment. Emancipatory research, empowerment research, similar concept. Yeah, good question. Other questions about cultural competency, either in terms of practice or your research? Okay. All right, establishing partnerships. Whoa. The very tricky part of the work. Right? In order to do community research or international research, part of cultural competency is partnerships, right? But not all partners are the same. So we must be very, very careful when we think about choosing a partner for our research. These are some things to think about. These are the things to think about. What is the level of experience that your partner has in working with the community? You do not want someone else who is also new. You also do not want a community partner that is controversial, meaning that they have had some bad experiences with the community in the past. So you have to be very careful when you think about your partner. Do they have the respect of the community that you want to work with? Do they have the skills and expertise? Are they ethical, meaning that they will not do anything in terms of the money, in terms of anything that is unlawful or inappropriate? Second thing is, how well are you able to communicate with that community partner? Again, there are cultural differences, and so some community partners, the leaders there may have a style of communication that makes it too difficult for you, the two of you, to work together. Doesn't mean that they're wrong. It just means that it's not the right match in terms of you and your partnership. Okay. Personality. Some people are more friendlier than others. Right? When you're thinking about a partnership, especially for research, it can be a partnership of many, many, many years. And so you want to be sure that you can be friends, right? That you can work together as friends, as colleagues. That you had talked about ways of conflict management, that if there is a disagreement, the person doesn't throw the chairs or they say, oh, I need you. No, that they are able to sit and calmly discuss what the issues are to move forward. Some sensitive issues with your partner that you must talk about in advance. The first is ownership of the data. Whose project is this? And who owns the data? Many researchers will come and they say, my project, my data, which means I take the data with me, I publish the data all by myself, I don't give you access to the information, right? That is not true partnership. So when you're talking about ownership of the data, it is important to have an agreement that this is shared data, that here's how you can use the data, and here's how I can use the data, and here's how we use the data together. Keep in mind that your community partner may have needs for the information that might be different from yours, right? And that it's appropriate to talk about that in advance in order for them to be able to use the information. Authorship. In emancipatory research or empowerment research, the philosophy says the community partner will always be first author, right? Because the goal is to build capacity. But in our universities, right, it's important for our promotion, it's important for our dissertation work that we serve as the first author, right, the senior author. And sometimes that can cause conflict if you have done a whole study, spent 5 years doing the study, now it's time to publish, and you assume that you're going to be the first author, and the community partner assumes that they will. So these are things that have to be discussed very early on in the relationship, so that in the end, there is no misunderstanding, and that the relationship does not fall apart, okay? So, in emancipatory research, the community partner is first. CVPR, the community partner is always an author. Traditional academia, the community partner is typically not listed as an author. I do not think, for me, cultural competency, that is not, in my opinion, that is not appropriate, okay? So for you, you have to decide in that partnership how you will proceed. All right. The third sensitive or tricky area is division of labor. Who will do what? Right? Sometimes the researcher says, okay, I bring you the idea, I go back to my office at the university, and they expect that the community partner will do all of the work. That's fine if the community partner agrees and you pay the community partner to do those activities. It is not fine if it has not been discussed. So it's a form of colonialism. Yes, yes. It's a form of colonialism if we come to the community and we say, here's my project, but I expect you to do all the work, all right? So, very clear in the beginning, who will do what activities, right? Also important for CVPR and for emancipatory research is to pay the community partners equally with the researcher. Is that common in Indonesia, to pay your community partner? Common, uncommon? Not common, okay. This is something that we are moving to in the United States, especially for us, people like myself, who are from stigmatized communities. We are making demands and we are showing leadership in the academic institution that says, you cannot go to my community and take. If you want to work with in my community, you must have partnership and you must pay the community partnership. That is a message. But again, different cultural context, but again, that's one philosophy, that's one big way of thinking about it. Okay. So when you're doing your partnership, it is important to build trust with each other. It is to work together to bring new resources and to be allies, but primarily to improve the health outcomes. What types of things, we say building trust is important. What types of things can reduce the trust in your community partner? What types of things can reduce their trust in you? What types of things reduce trust?
Oke Bapak Ibu, kira-kira dari kalau komunitas atau dari Bapak Ibu, kira-kira apa sih yang bisa membuat kita sebagai seorang perawat itu mengalami penurunan kepercayaan dari pasien atau klien? Dari atau mungkin dari partner kita? Boleh, silakan, nggak usah malu-malu.
Okay. Any ideas? What kind of things can reduce trust?
Tindakan apa yang kira-kira bisa membuat kepercayaan pada kita sendiri?
I don't know apa yang akan saya katakan. I don't know what topic I will say it here, but saya tidak ingin. Saya tidak ingin my daughter speak alone.
He doesn't want you to speak alone, so he will speak one or two.
Yeah. My mind, I think nurses in Indonesia is tidak percaya diri. Yeah, self-confident. Because in Indonesia we have different level, maybe not level, but pengakuan di masyarakat. Community, it means health community. Only health community, I think. Out of community in masyarakat, it's about who is in the nurses. But in health community, I think not all of the community, health community, ingin supaya perawatan.
Jadi maksudnya adalah memang di beberapa tempat itu mereka sudah mengakui perawat, gitu. Tapi orang-orang yang sudah mulai kesehatan ini maksudnya mengakui perawat.
Belum mengakui tentang perawat.
Masyarakat luas. Gitu.
Health community.
So it means that even in the health community itself, they doesn't acknowledge the nurse, the nurse role, the nurse function. So maybe that's the first thing that might have to consider.
Okay.
But right now, our step is to find many evidence ways to improve our community. We until the step to develop and improve our evidence base to improve our community. Thank you.
Yes, thank you, thank you. Good.
Ada yang mau menambahkan mungkin?
Anyone else know special things that can interfere with trust in your community partners?
Thank you. I will try to answer maybe. If we will try the community and the section and the other for instance, our able and take the advantage for our myself and
Yes, that is right. The same types of things that could interfere with trust in a personal relationship will interfere with trust in your community partner relationship. So if you lie, if you steal, if you cheat them, if you are disrespectful to them, those are the types of things that can interfere with trust. And those type of things, even though we don't think about it in terms of lying, stealing, those sorts of things, it happens when there is resources. So for example, if we work together and we get a grant and we do not give them their fair share of the grant, they do 90% of the work and they get 10% of the budget. That's cheating them, right? If I say to them that we will, when I do the project, I will leave the resources here for you, the computers, the information, the health materials, and I say, well, you know, I think I need those things for my next project. Yeah, that's lying to them. So the types of things, so think about it in terms of the same things that we would ruin the trust in a personal relationship will ruin the trust in a community, a research relationship. So we must be very careful to avoid those things, communicate openly and from the beginning, and if something has to change that is outside of your control, you sit and you have a conversation about that and make it clear that it's outside of your control. In the United States, researchers have such a bad history with the communities, with many communities, is that we have no trust. So the community is looking for us to make a mistake, to lie, to steal, to cheat, because we have done that in the past. So the researcher must be very careful to be ethical. And that may be something that is outside of your control, but we must take responsibility for it in order to retrain the trust in the relationship. Okay? Interesting to think about it in terms of interpersonal relationship, but that's essentially what it is, the partnership, personal relationship. Okay. So why the focus on the community partnership? It is that the community itself has the resources and the information to solve the problem. So as nurses, as researchers, we cannot be successful without community involvement. So, for example, if it's an immigrant population that has a lot of distrust about research, we will not be able to recruit our participants unless we have community partners that they trust, right? So in order for us to do our work appropriately, we must have that community partnership and buy-in. You understand this term buy-in? Community buy-in. The community people must say, yes, we accept this project as something that is good and helpful for us. And we want to participate. We want you to be successful. So many people, when I do a lot of research consultation, many researchers will come to me, Dr. Matthews, I got a big grant to do this work in this community, and I cannot recruit anyone. So, who's your community partner? No community partner. Who on your staff is from that community to help you to recruit and to understand how to recruit. No one from the community is on my staff. Who is your co-investigator, another scientist who has experience in this community? No other scientist with experience in this community. I think, good. I'm glad you cannot recruit because you are not the right person to be doing the work with that community because you do not have the cultural competency and the cultural humility. You have shown to me by your lack of involvement of a partner, of the staff, of another scientist, that you do not respect the community. And so if you cannot recruit, that says the community does not respect you, does not trust you. And so people are very surprised when I say that, but I tell them the truth. I say you must start with a partner. You must be in the community. You must make relationships. That is why you cannot recruit, right? Or did you put money in the budget to pay the participants? Well, no. Oh, do you get paid for your job? Well, yes, I get paid for my job. So you want them to come and work on your study, fill out your survey, and not get paid? That is their work. That is their knowledge. You must pay them for their knowledge. Again, showing respect. So those are the types of things that will come up with consultations that says to me that investigator, that researcher does not have the cultural humility and the cultural competency to work effectively in community. So, when we think about community engagement, the process of doing research has many steps. It is thinking about the topic of the study, thinking about what methods you will use, how you will recruit, how you will do the data collection and evaluation. Community involvement is appropriate at every single stage of the process, right? Every single stage of the process is important for community involvement. Not just at the end, not only at the beginning, not only when you're having trouble, but throughout the entire process. Funding. Getting funding. Many of us cannot do the work that we want to do on behalf of communities without getting grants or other sources of funding. So it's really important that we understand how to write good grant applications. There are international grants that are available. There are institutional grants. There are national grants that are available to you. Right now, these are the 6 criteria that have been used that are being used to evaluate the quality of a grant application. The first is the significance. Is this a topic important to the WHO, to your government, to your institution? Are you working on a significant and important problem? Okay? Now, you might be working on a problem that you think is significant, say, for example, quality of life in breast cancer patients. Yes, that's an important and significant problem, but there has been a lot of research that has already been done. So they will not view that as significant in terms of a new problem that is a priority. So you really have to focus on, is it an important area? Is it a priority nationally or internationally to demonstrate the significance of the work? The second is the investigators, meaning how well do you and your team have this training and the expertise to conduct the study? This is something that is very important because funders are not wanting to give money for people who do not have the training, the cultural competency in order to be successful. So you have to demonstrate that you or someone else on your team has the ability to conduct all phases of research, so investigative skills. The third is innovation. Is it new? Is it advancing the work that has been previously done? Is it innovative in terms of the population or the concept that you're focusing on? Or that are you using a new technology? Again, what is the innovation, the new contribution of your research? The fourth is approach. How well have you described your methods for conducting the study? Are the methods that you are using considered to be the gold standard or best practice? So the balance between innovation and approach for research is a very interesting one. For approaches, you want to make sure that you are using best practices or have developed a new technology or a new approach that you have some evidence for. Where you want your innovation is you want to have a balance between new ideas but best practices, right? You want to have it to be rigorous but new ideas.
Saya mengerti tidak Bapak Ibu. Jadi selain mengedepankan inovasi, juga harus mempertimbangkan bahwa research yang kita lakukan itu harus lebih mendalam, lebih lebih rigorous gitu. Jadi misal ada salah satu research yang sudah pernah dilakukan, Bapak Ibu boleh menggali hal-hal tersebut yang mungkin belum tergali. Tapi kita perlu mempertimbangkan bahwa harus ada inovasi dari hal yang sudah kita perdalam itu kita gali lagi. Seperti itu penjelasannya tadi. Jadi harus balance antara digging further, rigorous, and also the innovations.
Yeah, that's good. Thank you. All right. Environment. Are you working with an institution or a community partner that has the resources that will allow you to be successful? And then finally, are you doing the research that is ethical? When you write a grant, apply for funding, or even if you write a grant for a research proposal for your committee, these are the things that are being highly considered in terms of evaluating your project. In your opinion, which of these is most important?
Sekali lagi Bapak Ibu, dari ke-6 pendekatan ini, kira-kira bagian mana yang paling important, yang paling penting?
It's hard to decide, right? Here's how you two think about it. For the funder to be interested in your research, it must be significant and innovative. For them to be interested in you doing the research, you must just demonstrate that you have the skills and expertise. All right? So when they first look at your application or your research, they're looking at innovation and significance. Then they're looking at your ability as a researcher to do the work. But the final and most important criteria for making a decision to fund you versus you is the approach. How rigorous and scientific are your methods? Okay? So to have their interest, it must be significant, priority, innovative. But for them to give you the money, it must be rigorous. Yeah? All right? And also, of course, ethical, but we assume that would be. Many people think, oh, this is a brand new idea. It's very, very innovative. They must give me the money. Well, but you've never done the research before and your methods are not very good. They will not fund you just because you're innovative.
Thank you. I'm not quite understand about the approach, the methods of our research that the fund will give us to decide. Can you give me more explanation about what the meaning of rigorous? What method, combining this method and this method, more rigorous than the funder can give the fund to us?
Excellent question. So one of the things that demonstrate rigor, that you are using standardized measures of assessment, questionnaires, surveys that have been previously developed and are shown to be rigorous, that you are sampling, your sampling approach is appropriate, that the intervention that you are doing is effective and that it is being conducted in a systematic way. So it is like if you're doing an operation, it is like having someone come and observe your operation to make sure that you do the sanitation first correctly, that you do the incision correctly, that you do the procedures correctly. It is like that. It is demonstrating using your research methods that you can do the operation correctly. Does that make sense? That's clear? That's scientific rigor. And we learned that from your methodology course. Good explanation, okay? Okay. Okay. All right. Any other questions about what funders are looking at for when they are evaluating the research? Okay. So when you're writing your proposal, making sure that you're considering each of these 6 areas, because that's how you will be judged. All right. So the partnership. The partnership is evaluated in 2 areas. One, as a part of the team, the investigator team, and 2, as a part of your approach. Okay? Yeah. So that is how you talk about your community partnership, as a part of the team and as a part of your approach. So we will use our community partner as a way to recruit and to our study participants. Right? All right. Mm-hmm. Oftentimes, when your research is being evaluated, they want to know that it is a good idea, it's rigorous, you have good partners, good team members, but they want to have some evidence that it is feasible, that it can be done. The best way of establishing feasibility, the possibility of you doing the work, is through some evidence that you have the prior partnership and that it's effective, and that the intervention has been tried before and it's been shown to be effective. So when we talk about feasibility, right, can it be done? We look at 2 facts: the partnership and the intervention methods and approaches. So you have to show a little bit in your application prior work with the partnership and prior work with the intervention and the approaches. That's called demonstrating the feasibility of the work that you're proposing. It's a little ironic in that, it is a little strange that in order for you to get money to do a big project, you have to demonstrate that you've already done it. Yes? You have to demonstrate you've already done the partnership. You also have to demonstrate that you have some skills and expertise in how to do the intervention approaches. It shows it's feasible for you as a researcher to do the work. Very, very, very important. So, how do you demonstrate the feasibility of a partnership? Okay. One way is to show a history of collaboration. So if possible, it is very important for you and your community partner or your community researcher to publish a paper together. That can be a systematic review, that can be a small focus group that you have done with a community partner to talk about the importance of the issue for the community. Some work that you have done in advance to show good team, good partnership, we can work together, all right? So prior collaboration, is that always possible? No, not always. But ideally, you would show that I have been working with this partner for some period of time before I'm trying to get the funding. If it is a new partnership, if it is a brand new partnership, the most important thing is to have a letter of support from the community partner saying that they prove they are willing to work with you, that they feel like it's an important project for the community, and to detail what their goal will be on the project. Okay? So if it's a new partnership, there must be a letter of support. If you say that you're going to work within this community with this community partner and no letter of support, then the reviewers say, you have not shown feasibility that the relationship is there. So a letter of support is one strategy. If you're not able to do a prior project or prior publication. Letter of support makes sense? Okay. Yes?
When we say that my research is feasibility with novelty, when we say that research is feasibility with novelty.
So when do we say that our research is feasible and also we have a great novelty in our research?
Okay. Thank you. Yes, good question. So feasibility. In your proposal, you write a section called preliminary studies. Preliminary studies. That is where you talk about the prior partnership. That is where you talk about your preliminary work together. And that's where you show some of your preliminary evidence. So if you did some focus groups, you give the results. If you did a survey together, you do the results. Because it's there. So under the section of feasibility, you can talk about the community partnership. You can talk about your ability to recruit and to gather connection. And you can talk about any findings that are related to the project. So for example, if I'm studying quality of life, and I did a survey on quality of life, I put a little bit of that information in the preliminary studies. That's where you talk about that. Where do you talk about innovation? Innovation, you talk about it throughout the application. When you introduce the project, you use language like this. This is a highly innovative approach to reducing obesity in population X, Y, and Z. It is innovative because, and you have to specifically identify the ways in which it is innovative. It's not enough just to say innovative. No. You say it's innovative because. It's innovative because it's the first time we have worked with religious leaders in order to reduce domestic violence. It's innovative because it's the first time this theoretical framework has been used to guide the development of an intervention. It's innovative because it's the first time that telehealth has been used to reduce smoking among surgical patients, okay? So you clearly say, is it innovative because of the population, the theory, the partnerships, or the approach that you're using? Those are the 4 types of very typical ways to talk about innovation. I'll say them again.
Yes.
Population. Is it the first time that this research has been studied in this population? Is it the first time that this theoretical approach has been used to understand this problem or to develop an intervention? It is the first time that this type of community partnership has been used to address this issue. Or it's the first time that these methods have been used, all right? So population, theory, partnership, approaches, methods. Those are the ways in which you talk about your innovation. Okay?
Teori, jadi populasi, teori, kemudian partnership, dan yang terakhir adalah pendekatan.
Alright. Any other ways in which you can think about that you can demonstrate innovation? Those are the common ways. Those are the common ways. And so, you talk about it in your introduction. This is innovative. You talk about it in a second session, a very specific section. The heading, you say, innovation. And you describe the ways. When you're talking about your research methods, give us a new approach, and it's innovative. This method is innovative in this way, so that they see your discussion of innovation throughout the entire proposal. Okay? Good question, thank you. Okay, all right. I want to share with you some readings that I have been working on. I have some expertise in community engagement. These are 4 publications from last year that I worked on with my team. All of them are related to community engagement. And so if you are interested more in this topic, I recommend these articles for you, and it will tell you, first, this is a strategy of how to use a community engagement advisory board in order to develop your ideas and to think about best practices. This is an information for, again, advisory boards. This is talking about evidence for core cultural competency. This means this is talked about the problems that we have seen with researchers that have reduced trust and that have shown core cultural competency. All right, so again, if you're interested in these topics, those are some papers that you can read about. All right. All right. These, we can make these available to you. You can take a look, take a look, take a look, take a look. And finally, publication. Publication is important to disseminate your research, but from a community standpoint, it's not enough to only publish in the scientific journals, all right? You need to do that for your career, okay? And you need to do that to advance nursing science, But it's also very important for you to publish your results with your community partners and community newspapers, using social media approaches, using blogs. This is, again, community empowerment, emancipatory, so that the information doesn't leave the community and only go to the scientists, that the information stays in the community. So the way that it stays in the community is for you to come and give a community lecture. It's for you to write a small piece to go in the newsletters for the community organization or for the newspapers. Many people think, I'm not going to do that because it's not publication, I cannot put it on my resume, my vita. No, you give back to the community by providing this information in these types of places, right? But it is vitally important to do good community-engaged research is to also publish your findings in a way that the community can understand and learn and benefit from their contributions. So I'll stop there and we can talk. I have questions? Okay.
Saya akan ngomong dalam bahasa Indonesia dulu. Jadi itu kira-kira apa yang sudah disampaikan oleh Profesor Matthews. Mungkin untuk yang terakhir kali teman-teman atau Bapak Ibu agak terbayangkan yang bisa membayangkan bagaimana ini ceritanya begitu. Jadi mungkin saya mau kasih contoh adalah salah satu program pengabdian masyarakat di UI. Jadi sebenarnya pengabdian masyarakat di UI, kalau kita boleh ngomong adalah sudah menerapkan hal-hal yang tadi dijelaskan oleh Profesor. Jadi bagaimana kita menyoroti partnership atau kerjasama dengan masyarakat, di latar belakang kita harus sampaikan, bahwa saya pernah melakukan kegiatan pengabdian masyarakat di tahun 2018 katakanlah, dengan tema bahwa saya ingin meningkatkan kualitas hidup lansia di Depok, mungkin gitu. Kemudian untuk proposal selanjutnya kita boleh bilang dengan hasil bahwa di pengabdian masyarakat di tahun 2018 telah terjadi peningkatan kualitas hidup, maka untuk di pengabdian masyarakat ini saya akan menambahkan pelibatan yang lebih aktif oleh kader misalkan, atau mungkin akan ada kunjungan berkala ke rumah. Itu yang dimaksud dengan bagaimana kita menonjolkan inovasinya dan dijelaskan. Hal ini penting karena ternyata dengan cara adanya kunjungan rumah yang teratur, kemudian ada forum diskusi yang difasilitasi oleh kader, masyarakat akan lebih ikut, gitu, akan lebih terlibat. Mungkin itu ya yang saya tambahkan untuk diskusi menanggapi penjelasan Prof. Matthews tadi. Oke, sekarang akan masuk ke sesi tanya jawab. Kita masih punya waktu sekitar 15-20 menit. Apabila Bapak Ibu ada pertanyaan, silakan silakan. Jangan malu-malu. Oke, satu pertanyaan di depan. Ibu-ibu yang di belakang mungkin mau tanya 2, 3 dulu kali ya. Setelah itu kita buka satu lagi kalau mungkin waktunya memungkinkan. Ada lagi? No? Tidak usah malu-malu, jangan malu. Oke, tidak ada ya, berarti 2 dulu, silakan.
I'm Sima from Community Health Nursing in Faculty of Nursing. I want to ask about, you say that it's in UN to pay the community. That means it's right to pay the participants. The other word, it can be something unethical or something ethical. Because maybe the participants who want to work with us because we pay the participants. That's one question. And the second question, maybe it's okay if we publish the result of our effort in social media or even our public, while our paper has been published in journal or has been published in a seminar or a conference. Like that. Is okay or not okay? Okay, thank you.
Okay, thank you. So, excellent.
I have another question. Would you like to answer it first or maybe the second question you will go first? It's up to you.
Okay, let me just, I forget, I'll forget. Okay, first question is about payment. Yes, there's a balance between you not paying so much that they feel like it's coercive, right? That they don't really want to do it, but you're paying them so much money that they need the money and they must do it. And so what we say is that it's a balance between paying them for their time and effort and not so much that it is unethical and coercive. So sometimes a small gift, sometimes a small food, sometimes a very small money for the participants, mostly just to say thank you. Now the community partner, you must pay more. So the second case is it okay to publish in the journal and in other outlets? Yes, but you don't publish the exact same thing. So you may write it one way for the journal, but you write it in another way so that the community can understand it, right? So there is no problem in saying, writing a little summary of your published research in the blog or the newspaper, no problem.
Oke, jadi tidak masalah ya Bapak Ibu kalau memang mau mempublish hasil mungkin premasnya di jurnal ilmiah itu nggak masalah. Tapi yang harus digarisbawahi bahwa kita juga harus mungkin mempublish atau menyiarkan bahwa mengabarkan kalau ternyata di desa ini telah dilakukan upaya kesehatan dan ternyata ada hasilnya didukung oleh siapa. Jadi tidak hanya stay di desa itu, tapi orang luar juga tahu, mungkin orang yang bisa akses dari handphone atau mungkin yang biasa membaca surat kabar. Itu tadi. Di UI pun sekali lagi saya contohkan karena mungkin ini sebenarnya sudah berlaku di UI, jadi supaya familiar saja. Ketika kita akan mempublish atau melakukan kegiatan Renmas, kedua hal tersebut menjadi syarat yang wajib begitu. Tidak hanya kita publish di jurnal internasional atau jurnal ilmiah, tapi kita juga harus mempublish di berita populer kayak gitu. Karena itu sumbangsi kita ke masyarakat, memboost mereka, mempromot mereka, apa yang sudah kita lakukan. Gitu ya. Satu lagi pertanyaan tadi dari
Thank you for this visit. I want to ask you about partnership and how to. I want to ask you. It is kenyataan di lapangan. In reality, it's not theory, but sometimes we have to research about one thing, and especially example is nurse school. School nurse. It's how to advocate the government that is important about the significance. We talk about it. This problem is need to be improved, untuk diangkat menjadi sebuah masalah. Namun mereka merasa ini bukan masalah. Jadi, and then we have no partner to untuk membuat suatu penelitian ini bahwa student is very important. Bagaimana cara how to build the partner in the game.
Because the question is about how to advocate maybe the school board or maybe the school institution that there are specific health problem and this is important to make an intervention, but they don't think that this is important. So how to advocate that?
Okay. So what to do when the community doesn't recognize or it's not a priority for the community?
And they say that they don't have partner.
Okay. So let's take them separately. First thing is how to find a partner. You can ask the faculty who are also working in this area, do they have a recommendation for a community partner for you? then you must go and meet them and to share your ideas and to slowly build the relationship. The other is to identify what community organizations or NGOs are already working on this project, on this problem. And because they have access to the community and they recognize the significance. So that is another way. So work with your advisors or to identify who in the community organizations are already doing the work that you're interested in and work to collaborate with them. How to build the understanding and the significance. It's related to education. So it's important to meet with them to provide them a professional lecture for the staff and the faculty, to provide the community with a lecture on the importance, and then to maybe work with family members to advocate for you as this is an important issue that should be brought to the school. So it's building understanding and awareness among the teachers, among the administrators, and among the family members about the importance of it. And then using that as a way of helping to increase the interest in it. Okay? But again, it's very hard for us as outsiders to come and say, hey, this isn't important. So that's why it's usually good to work with organizations who are already working on this project, or if not, to work with family members to increase awareness. Okay. It's hard work. It's hard work.
Kita butuh pengertian juga dan mungkin perlahan-lahan. Jadi dengan tadi yang disampaikan Prof. Irfan, kita tidak hanya mempropos apa yang kita inginkan, apa yang kita lakukan, tapi kita juga sebelumnya harus bisa mungkin non formal atau mungkin secara formal mendengarkan dari pihak sekolahnya itu sendiri. Kira-kira apa yang bisa kita bantu, apa yang menjadi masalah di sekolah ini sebelum akhirnya tadi seperti yang dijelaskan. Oke, kita masih punya waktu 5 menit. Ada lagi yang mau bertanya? Satu orang di depan. Yang belakang kayaknya anteng-anteng banget. Silakan Bapak Ibu. Nanya dalam bahasa Indonesia tidak masalah. Pasti saya akan bantu. Mungkin terkait risetnya mungkin yang masih bingung-bingung, mentor gitu ya. Bisa ditanyakan juga. Ada? Kamu bisa bertanya? Oke, silakan Ibu.
Okay, thank you for that. I'm really interested about this topic about global research, but I have a lot of information about the access. Is it always we have to have a cooperation and collaboration between different countries, university, or for the access to have the global research? Or can you tell me about other resources that we can have, the funding for the global health research?
You really do the cooperation with another university or another researcher is very, very important in order for you to have success with your recruitment and your ability to do the work. So that again is a different type. It is critical. So how can you learn about funding opportunities or research opportunities? Does your program have a global health research program or international partnerships? In the university or in the college university?
But we do have for the research surrounding that is a specific or maybe community engagement program that is doing mainly annually, and we can submit our paper to that. We can contribute.
So a couple of different strategies. If a presenter comes and is in your area, continue to try to build a relationship with that researcher. And the second is to look to see what programs your university sponsors, because one of the goals is that most universities have a global health or international relations. And so to go and consult with them about which country or other partners, that's second strategy. And the third is as you read the international literature, who is publishing in that one topic in the country you're interested in working with? And you can write them an email and say, I've read your articles, I'm very interested. Can we have discussions and about maybe forming a partnership? So those are the three strategies. If an investigator comes here, or working with your institution, or contacting a researcher based on an article that you have read.
Maybe I made a mistake because as I know that our university have international research. Yeah, we do have. Actually, the first of all is maybe with the European. I think it's England. We have the mental health research, and then recently we built a collaboration with the international, maybe IT corporation, and yeah, we do the international research about the mother and child health. Yeah, I think we do the international research every year, I think, and the results. Yeah, well, the result is quite good, and we also involving the student, whether it's the bachelor or maybe the master, and also the doctoral student in that. Maybe that's new for the people in the audience here.
Mungkin Bapak Ibu kalau memang ingin gitu tadi, di mana kita bisa mendapatkan pendanaan, benar. Mungkin terlibat dalam kolaborasi dengan institusi internasional. Mungkin kalau dari kita bisa dengan lewat pembimbingnya, mungkin beberapa dari kita mungkin sudah terpapar ada juga terkait dengan penulisan tugas akhir, kemudian penulisan PEMAS. Mungkin nanti bisa juga mencoba untuk dari sponsor yang menerbitkan jurnal atau artikel yang kita tulis seperti itu. Okay.
Last question, yeah.
If I want to ask you in Indonesia language.
Dalam satu kondisi misalnya ada institusi yang mengajak kita bermitra, tapi institusi tersebut masih terkait dengan kerjasamanya di tempat lain. Nah, dia merasa tidak puas dengan kerjasama tersebut, lalu ingin mengalihkannya ke kita. Bagaimana kita menanggapi hal ini dan bagaimana cara langkah-langkah kita untuk memulai kerjasama dalam kondisi seperti ini? Iya, dia sudah institusi ini sudah menjadi kerjasama dengan yang lain 1 tahun berjalan, misalnya selama 3 tahun, baru 1 tahun lalu dia ingin mengalihkannya ke kita karena dia tidak puas dengan kerjasama sebelumnya. Nah, kita sendiri sebagai orang yang dinikmati, bagaimana langkah kita supaya kemitraan dengan institusi tersebut bisa berjalan? Thank you.
So there's certain cases that there is a shared relationship, but the two partners so the first institution wants to build another new partnership with them, and then how do we have to do what we have to do, how to make this partnership stay longer. And we know that there is a history that they have a broken relationship.
Yeah. So great question. So thinking about some of the things that we were talking about in the lecture, understanding what the sensitive issues are in advance and being able to have a conversation about those. Thinking about what happened to break the relationship, the prior relationship, and learning from those so that it doesn't get repeated in this relationship. And being willing to do not avoid the problem as they happen. If a problem is going to happen, have open communication because that's the best way of solving it without it breaking the relationship. So don't be afraid of having the honest communication. Honest communication will either strengthen the relationship or allow you to say, this maybe is not the best partnership and we end, but we end as friends, not in common.
Jadi benar-benar dengan komunikasi yang baik ya. Ditelaah dulu apa penyebab yang mungkin bisa menyebabkan kemarin partnershipnya terputus, kemudian jadi komunikasi tersebut kita identifikasi dan kemudian bikin komitmen baru tentang bagaimana nanti partnership yang akan dilanjutkan. Okay, I think it is the time for us to end this very fruitful discussion, yeah? Or maybe is there any question before we end the session? No? Oh, okay, all right. Okay, if you want to email Professor Matthew, there's an email there on the bottom of the slide. And can we have another question, Professor? Yes, sure.
Okay, thanks for the opportunity. I'm Christy.
I can't focus. Oh, there you are. It's like, who's talking? Okay.
I'm a student, doctoral nursing. I come from Papua, East Nusa Tenggara. There is border Indonesia and Timor-Leste. I think in there is a lot of phenomena from the recent research, and we have a difficulty to apply for the regulation because it's different country. Maybe you have a trick or strategy for me, and we can apply it in my hometown. Maybe you have strategy.
Oke, jadi risetnya itu dilakukan di Timor Leste-nya atau bagaimana?
Hasil riset itu dilakukan di Indonesia, tetapi di sini berbatasan dengan Timor Leste, jadi agak sulit untuk menerapkan karena berbeda regulasi, different regulation. Maybe you have a trick or strategy how to bagaimana untuk bagaimana membuat suatu dengan dua negara yang berbeda, bagaimana untuk menerapkan hasil-hasil riset tersebut.
So he just asked about how we could apply the research results in that working line because we do have a class of regulation in that.
Is it between like the institute, the IRB? Is it a institutional review board question, or is it how to is it
Masalahnya ada pada saat publikasi atau saat pengaplikasiannya, Bu ya?
Saat mengaplikasikan dari hasil riset tersebut.
So if I'm understanding, how do you disseminate to both countries?
Yes.
That's right. Okay. Yes. Do you have a community partner do you have a partner in the other country?
Yes.
All right. So thinking about with any data, it's possible to have multiple publications. And we think in this part of the data, we published in this language so that it gets to be disseminated in the other country. Part of it then we will publish in Indonesian, and then part we will publish in English language international journal, right? So that is something that I would try to think about. Are there different parts of the research that can be published in Indonesian journal, in that journal, that country's journal, and then international English language journal? So then the international community can benefit from the knowledge as well. So when we're thinking about global health research and international research, one of the things that we really want to try and do is to inform the international community about what lessons we are learning. But we also want to get back to that community or that country as well. So that's the balance between English language publication international and then publishing in that country's language as well. So for example, you might do a clinical paper that talks about how to educate the nurses about using the findings from the study. That can be in that country's own language. Why? Because you're trying to educate the practitioners. In the international journal, you might talk about the methods and the strategies. Okay? Yeah.
our intervention, maybe our approach. If we propose this kind of approach, how we apply this, we have to different regulations. We have some experience about different regulations.
I don't think I understand the regulation or two different regulations.
Because it is related to countries, I think. So they have different regulations. If we apply in order to apply our rules, the other government may need several maybe regulations or something like that.
Okay, yes, sorry, I wasn't understanding. So yeah, that's when you have your other research partner. When you're doing international research, you have to have an international research partner who does the institutional review board, who deals with all the government needs for the commissions. It would be very hard for me as a person alone to come to Indonesia and try to do research. I would not be able to handle all the regulations. That's why you have to have partners, research partners in both countries to help facilitate, to help ease that, your ability to do that one.
Bagaimana itu? Sudah terjawab. Jadi sebenarnya tadi dijelaskan bagaimana untuk mempublish research hasil penelitiannya, tapi juga tadi ketika kita menghadapi masalah atau konflik ketika akan mengaplikasikan sifatnya di negara yang berbeda, kita harus ini bagaimana bisa kita memanfaatkan atau mungkin bekerjasama dengan partner kita yang di negara lain. Dalam kasus itu adalah di Timor Leste. Jadi ketika kita ada kesulitan dalam mengaplikasikan intervensi di Timor Leste, biarkan teman kita atau partner kita yang di Timor Leste untuk memfasilitasi bagaimana regulasinya, bagaimana pengaturannya, seperti itu tadi yang dijelaskan oleh Prof. Kira-kira begitu?
We will try because that is
Very difficult for individuals, right? But yeah.
It takes longer to do global health research, international research. It takes longer than it does to do research in your own country. But it's very rewarding. The impact can be very good. Yeah.
Ada lagi? Tadi sepertinya itu yang disebutnya ada di mana yang sudah? Tidak ada? Kalau begitu, berhubung waktunya juga sudah habis, sekarang sudah jam 11:11. Mungkin saya akhiri, kalau saya bisa sama-sama di Inggris sama di Indonesia. Oke, saya bilang di Inggris dulu ya. Jadi, in conclusion, I think it's such a very open-minded and such a eye-opening discussion we have this morning. So I think knowing that Indonesia has so many cultural diversity, it is important that we understand about the cultural competencies came. And as you, the next leader, or maybe us as the next leader, a comprehensive understanding of a cultural competencies is essential to start the research for addressing the global health problem. So let's take one step to build our awareness about the culture and also listen to your community needs. And after that, we can build strong partnership. So another step will follow for us enhancing establish global health. Thank you so much, Professor Matthew, for such a fruitful discussion. Okay. All right. Now that the discussion is finished, me as the moderator. Sekaligus menutup acara kali ini, terima kasih sekali atas perhatian Bapak Ibu semuanya. Semoga informasi yang disampaikan bisa mungkin membawa cercah ide atau mungkin sebuah ide yang bisa dibawa nanti ketika Bapak Ibu kembali ke wilayah atau melangsungkan penelitiannya. Oke, terima kasih banyak. Wassalamualaikum warahmatullahi wabarakatuh.
Orang ini.
untuk teman-teman yang belum mengisi daftar hadir, para mengisi daftar hadir.
Satu aja ya. Cuma satu. Cuma satu yang isi.
Ya,